The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits and reports on the results of these audits to Parliament. On the 23rd of March 2016, the Auditor-General tabled his performance audit report, Bullying and Harassment in the Health Sector. So what is workplace bullying? We use Safe Work Australia's definition of workplace bullying, which states that it is repeated and unreasonable behaviour that's directed towards a worker or a group of workers that creates a risk to health and safety. It is important to note that it sits towards the extreme end of a continuum of inappropriate workplace behaviour. Research has shown that workplace conflict or minor inappropriate behaviours can easily escalate into bullying and harassment. This audit focuses on inappropriate workplace behaviour more broadly, which includes bullying and harassment. In summary, the audit found that there's insufficient priority, leadership and accountability in health sector agencies in addressing the risk of bullying and harassment. Key controls are either inadequately implemented or missing, including effective early intervention and formal complaints processes. The inability of health sector agencies to effectively prevent or respond to high levels of inappropriate behaviour means there is a need for stronger sector-wide leadership and guidance for the health sector that's consistently implemented. Bullying and harassment can have serious social, health and economic consequences for those immediately involved and for the health sector more generally. These include effects on individuals' mental and physical well-being, quality of patient care and outcomes, and economic costs to the healthcare profession. It is difficult to accurately determine prevalence because of poor reporting. However, results of self-reported experiences of bullying are sufficiently consistent across research studies to indicate a concerning problem. For example, 2 surveys in Victoria found that 25% of health workers and 40% of nursing professionals who responded to the surveys reported that they had experienced bullying in the last 12 months. Additionally, in one survey across Australia and New Zealand, 39% of surgeons and 54% of trainee surgeons who responded reported experiencing bullying in their career. These results are a concern given the health sector is the largest public sector employer and that Occupational Health and Safety (OHS) legislation obligates employers to eliminate or minimise these risks. This audit examined the effectiveness of health sector agencies' controls to prevent and respond to inappropriate behaviour, including bullying and harassment. We examined 4 health services: Ambulance Victoria, the Department of Health and Human Services, DHHS, as the system manager, WorkSafe as the regulator, and the Victorian Public Sector Commission, VPSC, which is responsible for public sector improvement. All, with the exception of VPSC, have a role to play in supporting the health sector to fulfil their responsibilities under the OHS Act to eliminate or minimise health and safety risks. In terms of our approach, we conducted site visits at 5 health sector agencies, and we examined health sector agencies' controls and conducted extensive interviews and focus groups involving over 130 employees. We also undertook a public submission process, which generated 82 submissions. The audit found there were clear problems with the culture of health sector agencies in relation to inappropriate behaviour. Indications of poor culture included that boards and executive teams of the audited agencies do not prioritise and are not accountable for effectively managing this risk. The failure by health sector leadership to understand the prevalence, impact or causes of bullying because data reported to them is either absent or unreliable. And widespread fear, resignation and normalisation of poor behaviour by staff leading to extensive underreporting. These factors all combine to hide and deny the risk. If boards and leaders do not take this risk seriously and ensure a positive culture is in place, nothing is likely to change. Policies, procedures, and training to recognise and respond to inappropriate behaviours are key elements that can contribute to a positive culture. However, health sector agencies' policies and procedures are not effective as they are ambiguous, have significant gaps, and are not understood or complied with by staff. Training is similarly inadequate because it is ad hoc, superficial, and not mandatory. Early resolution of issues before they become more serious or damaging, or escalate into more serious bullying incidents, is critical for successfully responding to inappropriate behaviour. We found that early intervention by line managers was inadequate. Trust in this process is low, and that line managers lack sufficient capability in this area. None of the audited agencies systematically respond to formal bullying and harassment complaints. There were extensive deficiencies at each step in the process, and formal complaints are not receiving the priority or attention they demand. Given these challenges, strong sector-wide leadership from DHHS and WorkSafe is needed to support the health sector to better prevent and manage inappropriate behaviours. However, guidance provided by DHHS, WorkSafe and VPSC has not been sufficiently tailored to the health sector and the challenges a hospital environment can pose. There is also poor collaboration between the key sector-wide agencies, DHHS, WorkSafe and VPSC. The limited exchange of information between these agencies and poor pooling of knowledge represents a missed opportunity to support health services reduce the risk of bullying and harassment. In total, we made 16 recommendations. The recommendations can be read in full at the end of the audit summary in the report. We made 12 recommendations to health sector agencies that focused on improving governance and oversight of this issue by boards and senior health service leadership, implementing a comprehensive approach which is supported by improved capability, including training, and ensuring an effective formal response system is in place. We also made 4 recommendations to sector-wide agencies that focused on providing stronger sector-wide leadership to support the health sector better address this risk. It is encouraging that all agencies have accepted our recommendations and that the Australian Medical Association of Victoria's recently released strategy to address widespread bullying, discrimination and harassment in Victoria's health system represents a true step towards strengthening the sector's response to this issue. In summary, the key messages are that the available indicators point towards poor workplace culture where bullying and harassment is either accepted or poorly dealt with. Ineffective prevention leads to escalation of poor behaviour. Inadequate organisational response means there are limited consequences for inappropriate behaviour, which further perpetuates low trust and poor culture. And stronger sector-wide leadership is needed to support improved management of this risk across the health sector. Our overall message is that greater leadership and sustained commitment is required from health sector leaders to build a positive culture through effectively responding to inappropriate behaviour and bullying and harassment. Relevant audits are listed on this slide. All our reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.